Welcome to session 4 of Introduction to Experimental Psychology, Psych 224. So this session is going to be in 2 parts. I mentioned in the previous session that when you are conducting research, there are 3 important variables that you have to identify, which is the independent variable, the dependent variable, and extraneous variables. So these are the variables I'm going to define in this session. And then the second part, I will talk about the terminologies that are used in experimentation. And these are terms that you have to familiarize yourself with because you hear them every now and then. So at the end of the session, you should be able to explain the role of variables in experimentation. You should be able to describe the types of variables or the various categories of variables that we have. Then you should be able to distinguish the 3 variables in experimentation. And finally, you should be able to list and explain the various terminologies that are used in experimentation. So basically, I'm going to cover 3 topics: the types of variables, the 3 variables in experimentation, and then terms in experimentation. So this is your reading list. Again, ensure that you read the chapters in these textbooks. So let's start. I'll first talk about the types of variables in experimentation. So Kent always defines variables as the gears that make experiments run. So think about it. What is it that makes a car move? When I ask this question, students will always say, oh, it's the steering wheel, it's the tires underneath the car, it's the petrol in the car, etc., etc. You need all these things. But think about it. If you don't move the gears, the car will be stationary. So in the same way, variables are the gears in an experiment that make the experiment run. If you don't have the variables, you don't have an experiment. So in every experiment, you have an independent variable, you have a dependent variable, and you have extraneous variables you have to control. And Cosby 2001 defines a variable as any event, situation, behavior, or individual characteristics that can be varied to have at least 2 values. And I'll explain this as I go along, or you understand this better as I go along. So a variable could be a behavior, for example, because you can vary behavior as being good behavior or bad behavior. So for instance, you can say that students who are of good behavior will perform better than students who are of bad behavior in the classroom. You could also vary emotions as being sad, happy, or angry. So for instance, students who are sad are less likely to answer questions in class than students who are always happy. So an experimenter can have various levels of these variables that I have just mentioned as well. So for instance, I've mentioned that you can vary behavior as being bad or good. And when you talk about good behavior, you could also vary that good behavior to be good behavior or very good behavior. Or you could have somebody being angry, somewhat angry, or very angry. So you can vary these on various levels as well. So the effective selection and manipulation of variables makes the difference between a good experiment and a poor experiment. If you don't choose your variables well, if you don't manipulate them well, that can affect the outcome of your study. You can end up with a poor experiment. Now, there are various ways in distinguishing variables. One way of distinguishing variables is by categorizing them into discrete variables or continuous variables. So let's talk about discrete variables. These are variables that come in whole units. So for instance, you can have someone who is of black race or white race, someone who is male or females. So discrete variables come in whole units. You are either male or female. You are either black or white. So even if you are a bit of black and a bit of white, you are categorized as being mixed race. So an individual will belong to one category at one time. You are either well or you are sick, etc. Then the second one is continuous variables. So these are variables that form a continuum. So they can be represented in both whole and fractional units. So for example, if you are looking at people's attitude towards work, you could have extremely positive attitude, you could have positive attitude, and you could have extremely negative attitude. So these variables, which are continuous variables, are on a continuum. Now variables can also be qualitative or quantitative. So let's look at qualitative variables. They are variables that vary in kind. So we manipulate a quality or an attribute of a situation that participants are exposed to. So for instance, if we are manipulating the quality of room lighting, that is a qualitative variable. Room lighting is the qualitative variable. So we can say that we will have the experiment in a dim room or a brightly lit room. So room lighting in this case would be a qualitative variable. In the same way, if let's say we are investigating psychological illnesses, we could say that we are looking at different sorts of diagnosis. So those who have schizophrenia, those who have depression, etc., etc. Now when you talk about quantitative variables vary in amount. So the word says quantitative, so the quantity varies. With the previous one, it is the quality that varies. So talking about quantitative variables, manipulating the amount of the variable is what the researcher is interested in. So you manipulate the amount of the variable that the participants are exposed to. For instance, loudness in terms of having, for instance, the decibels. So you are testing loudness. You could vary the decibels. You are testing, for instance, you have a research that is looking at the effect of practice on performance. You are varying the amount of time that people practice. So people could practice for 20 minutes, they could practice for 10 minutes, etc., etc. So we are varying the amount of time that people use to practice. If let's say we are looking at the effect of alcohol on recall, we vary the amount of alcohol that participants are exposed to. Now let's look at the three variables in experimentation. I've mentioned this earlier on, but I'll go over this again. So I'm going to be very brief. I've identified the independent variable, dependent variable, and extraneous variables. Now with the independent variable, it is a variable that is systematically manipulated by the experimenter. I mentioned earlier on that this is the variable that the experimenter will vary or the experimenter will manipulate to find out the effect of this manipulation on the dependent variable. So for instance, increasing the amount of practice should increase the performance on a task. So it should be one that can be manipulated, and there are several ways that a researcher can manipulate the independent variable. So you have the presence versus absence technique, where you have two groups of participants. One is given the independent variable and the other is not. So if you take, for example, alcohol intake and performance, you have one group that receives the alcohol, the other group doesn't. If you take the effect of feedback on performance, you give one group of participants feedback on a task that they perform, and then you don't give feedback on the other group, basically to find out that if they perform a second task, what will be the effect of feedback. So that is the presence versus absence technique. Then we can also vary the independent variable by administering different amounts of the independent variable to the several groups that we are testing. So again, using the example of alcohol, if let's say we have 4 groups of participants, we would administer different amount of alcohol to the 4 groups. We can say that one group will be the control group, so they will not receive any alcohol at all. Then the next group, so that will be group 0. Then group A will be administered 1 bottle of alcohol, group B will administer 2 bottles of alcohol, and C will have maybe 5 bottles of alcohol. So we are varying the amount of independent variable that we are administering. Then thirdly, we can also administer different types of independent variables to the participant. So if you take feedback, for example, we have positive feedback or negative feedback. Or if we are testing psychological illnesses, we want to find out how stress can improve people's illnesses. We can look at how stress affects hypertensive patients. We can look at how stress affects people with diabetes, and see that if we reduce the stress, how will it improve the lives of these individuals. So here we are varying the type of independent variables that we are giving to the participants. So 3 ways: the present versus absence technique, administering different amounts of the independent variable, or administering different types of the independent variable. So let me look at this example. Identify the independent variable and how you vary them. I'll do the first one and you can go ahead and do the others with your colleagues. Effect of types of information given to participants on the amount of information remembered. So let's say we have 2 groups of participants, then we give them 2 types of the same information but in 2 different forms. So one will be, the information will be organized. The second one, the information will not be organized. So that is how it will vary the independent variable, which is the type of information. And then we find out the difference between the 2 groups on a task. I want you to work out the rest of it and identify the independent variables in here. Now let me talk about the dependent variable. This is the variable whose value is observed and recorded by the researcher. So it measures the influence or effect of the manipulation of the independent variable. So we're expecting that when we manipulate the independent variable, the dependent variable will change. So for instance, if we give people alcohol, it will affect their performance. Their performance will change. If we let people practice on a task, it will improve their performance. So that dependent variable performance will change as a result of the practice that participants are involved in. Now, these are more examples. So here I want you to again identify the dependent variable and how they will be measured. So again, I would work out the first one. I mentioned previously that we can have 2 types of information: organized information and random information. So in this case, our dependent variable will be the amount of information that participants will remember. So 2 groups of participants, one will be given organized information to read, the other will be given random information that is not organized. So the same type of information like the first group of individuals, but this is not organized. And then we ask them to recall this information. So the recall of the information, or how much information they remember, will be the dependent variable. So try and work out the rest of the examples. Extraneous variables. So again, I've mentioned this in the previous sessions, that there are variables, any variables other than the independent variable that is not of interest to the researcher or the experimenter, but can affect the outcome of the study. So they are also termed as potential independent variables because they can also change the outcome of the dependent variable. So for instance, if we want to look at the effect of instructional strategies on students' performance, so the way we teach, for example, if we make our teaching interactive on one hand, and if we make the teaching in such a way that it's not interactive, so we just stand before you and we teach and teach without asking you questions, asking you for contributions, etc. We want to compare that method with when the teaching is interactive, and then we test you on whatever we have taught you. In this case, if let's say whatever material we are giving to you as the test is something you have worked out before, obviously prior knowledge will be an extraneous variable. So it's important that extraneous variables are controlled in experimentation. This is another example. So identify the possible extraneous variables in these examples, same as what I gave you for independent and dependent variables. So again, in the first instance, looking at type of information and information remembered. Again, prior knowledge, if the individuals have read this material before, that can affect the outcome of the study. So at the end of the day, we will not be able to say whether it's because the information was organized or it's because it was randomized. We will not be able to distinguish the difference between the 2 groups because a potential independent variable, which is prior knowledge, has affected the rate of recall. So these are the 3 main variables in experimentation that as a researcher or a psychologist you should pay attention to. Now let me talk about terms that are used in experimentation. So again, these are terms that you come across ever so often, so you need to familiarize yourself with these terms. The first is population. So I'm sure you know what a population is. I'm sure you've done it in your previous years. But let me just briefly say that it's the entire collection or group of people or animals belonging to a particular category that the researcher is interested in investigating. So the target population is made up of all the individuals that you are likely or you'll be interested in testing as a researcher. And what the researcher does is that he or she selects some of the individuals from the population. So for example, if I want to test students of University of Ghana, obviously I can't test all 30,000 students. But so my population will be University of Ghana students, and out of these University of Ghana students, I'll select some of them to test. Or if I want to test students in the DE program, I cannot test all students in the DE program, so I'll select some of them and then test them. So my population will be all students in the DE program. My sample will be those that I select. So that brings me on to what a sample is. So a sample is basically a subset of a population. From what I've just said, I mentioned the fact that you can't test the whole population, so you select some participants from the population in order to test them, and these are what we refer to as a sample. A sample are people selected from a population to be tested as research participants. Now, in every research, you have to decide on your sample size. And usually, your sample size will be determined by the type of research design that you are using or the type of research method that you are using. So, for instance, if you are doing a quantitative research or if you are doing a descriptive research study, you may need hundreds of participants. So, let's say we are doing a survey. So, the university, for instance, has been talking about a school feeding program where it's been, the vice chancellor thinks that if we give students one good square meal in a day, it will help them, and in terms of they having a balanced meal, at least one balanced meal in a day. Well, that has not taken off yet, but if we want to find out students' opinion, whether they think that this is a good idea, we can do a survey. So in this case, we need to test hundreds of students to find out their opinion about the school feeding program. If you were doing an experiment, you would need fewer participants than you would need for a survey. And again, if you're doing a qualitative research, you will need even fewer participants. So your research method will determine the number of participants that you need. So that brings me to participant. Who is a participant? Participants are people who collaborate in an experiment for the purpose of allowing their behavior to be observed by a researcher. So basically, the people that you have selected and you are testing in your research. So for instance, if it's a research that is on psychotherapy, you would want to maybe test a group of people with a particular phobia or a group of depressed people. Or if you are looking at research among people with diabetes, you are testing people who have diabetes. Another term that you find commonly used in experimentation is the experimental group. I think I've mentioned that earlier on. So the experimental group is a group of participants in an experiment that receive the treatment condition or some amount of the independent variable. So if we vary our independent variable, and then we have students who would practice and students who will not practice. Those who will practice will be the experimental group because they receive the treatment condition. It's also known as the treatment group. Then we have the control group. So with the example I just gave, those who do not practice on the task are those who will be the control group. Or if we have two groups of participants, those who receive feedback and those who do not receive feedback. Those who do not receive the feedback are our control group because we want to compare them with those who receive the feedback to find out whether feedback has affected performance. So the control group serves as a standard of comparison to determine whether the treatment that was given was effective or not. Now, one thing you should notice that when you're doing research and you have an experimental group and a control group, you have to make sure that the two groups are equal, they are similar. There are no differences. So if I'm testing level 100 psychology, DE psychology students, they should all be level 100 DE psychology students. There shouldn't be massive differences in terms of having level 100 in group A and having level 200 in group B, or having level 100 in the experimental group and having level 200 in the control group. The groups should be similar. Then we have the confederates. So a confederate is a person in an experiment that has been instructed to behave in ways that could affect the responses that participants make. So these are not participants. They merely help to administer the independent variable. They act as if they are participants, but they are not. So for example, if we want to find out the likelihood of people helping somebody who falls off at the threshold of a door, we have confederates standing about, and we have 1 or 2 people who are not confederates. So those are the participants we want to observe. We want to observe whether they will help the person who trips and fall or not, because research has shown that if you have more people who are present, it's less likely that the individual will get help, because everybody thinks somebody will help. So you have about 10 people around, but 8 of them are confederates, acting as if they are participants. But in actual fact, there are only 2 people you are testing. So they are pseudo participants, and we don't test them in research. Then we have randomization, which is a control technique that is used to equate participants. I'll talk more about randomization when I talk about how to control extraneous variables. But basically, it's randomly assigning participants to the various groups that you are testing, so that all the groups you are testing are equal on the various characteristics such as their age, their gender, etc., etc. There are several ways in which you can randomly assign participants to a group. So you can toss a coin, you can use a table of random numbers, etc. Then we have internal validity, and also another term that you come across. I think I mentioned that much earlier in the previous session. I mentioned the fact that in research, in experimental research, we try to establish a cause-effect relationship, and that is why we have to control extraneous variables. So internal validity is the extent to which a cause-effect relationship can be established between an independent variable and a dependent variable, which means that it's important that we control extraneous variables in order to establish internal validity. Finally, we have external validity, and this is the extent to which the findings of a research can be generalized to other situations or other populations other than the ones that were tested. So for example, if I test University of Ghana students, to what extent can I extend or can I generalize my results to University of Science and Technology students? If I test people with diabetes at Achimota Hospital, to what extent can I generalize my findings to diabetes patients in the La General Hospital? So this brings us to the end of session 4.